Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. January was a busy month, and the O&P field and profession was quite introspective in thinking through how the rest of the year will go and what kinds of policy priorities we need to focus on to advance the issues that lie before us. There's quite a few challenges ahead. First off, the LCD, the local coverage determination that was put on hold in the fall of 2015 while the federal government created a work group of federal employees to study the issues around lower limb prostheses and to make recommendations in the form of a decision memo in terms of where the evidence base is, what gaps exist, whether they can arrive at a consensus statement around lower limb prostheses. We'll be meeting soon, the NAAOP, along with Alliance sister organizations, with CMS to talk through these issues and to ensure that the public stakeholders, including all of our groups, have ample opportunity to interact with the work group throughout their deliberations. Next up is prior authorization. The prior authorization final rule was published on December 30th, 2015, as many people know. It has not yet gone into effect, but it may apply, it has the potential of applying to as many as 84 prosthetic limb codes. This involves all kinds of prosthetic components that have been detailed in one way or another in federal reports since 2007. The irony here, of course, is that recent Medicare data clearly reflect the fact that Medicare spends much less on prosthetics today than they did just in 2010. And so there is a real question as to whether they should be using prior authorization for any of these prosthetic codes. But we intend to go in and meet with CMS to talk with them about this issue and to get more information about what they plan on doing moving forward with respect to prior authorization and how they plan to actually roll the program out. We certainly intend to try to do all we can to mitigate the negative aspects of prior authorization and to improve the system to the maximum extent possible. Third, with respect to the Injured and Amputee Veterans Bill of Rights, the Congresswoman Elmer's staff and the Congresswoman herself is very interested in reintroducing the bill. We did have communications with Secretary Bob McDonald, the VA Secretary, last year, and ultimately we feel it's time to make a move legislatively to improve care for veterans who have amputations and who need prosthetic and orthotic care. We want to hear from you. Are you experiencing long delays in getting approvals from the VA to treat veterans? Do you have a VA contract? If it's been a long-standing contract, are you getting referrals to veterans? Those are the kinds of questions we're looking to try to explore to see and to inform our policy options going forward. Please go to the website, www.naaop.org, and send us a quick email letting us know how you're interacting with the VA and whether the VA system is working for you and your patients. And finally, a unique opportunity has come about at the end of April 26th and 27th, and we strongly encourage you at NAAOP to attend the Orthotic and Prosthetic Policy Forum in Washington, D.C. AOPA is spearheading and organizing the policy forum. It's an annual forum where people come from throughout the United States, come into Washington, meet with their legislators, learn about orthotic and prosthetic policy, and really represent the field.